Hi, Dr. Sidanan here. Okay, so today we're going to talk about cataracts, and some of the topics we'll be talking about here will be the definition of a cataract, what are the causes or risk factors for cataracts, some of the symptoms you may experience if you have cataracts, the types of cataracts, the investigations to diagnose cataracts, treatments that are available, and we can talk about the possible prevention or slowing down of the formation of cataracts. So we'll be going through these topics one by one, and stay tuned. Okay, so before we delve into cataracts, let's talk a little bit about the eye anatomy so you'll understand where it is I'm coming from. So of course, this is a model of the eye. These here are the extraocular muscles. These are the muscles that will turn the eye left, right, up, down. Okay, and now just open this up a little bit. Okay, there you go. Good. So this here, that's the cornea. Okay, that's the first clear window of the eye. As you can see, it's curved, and this helps with the focusing of light as it enters the eye. Next part here, that's the iris with the pupil. The pupil is the hole. It is the iris that gives the eye its color as well. The pupil has the ability to get smaller and get larger. It all depends on where it is you're trying to focus. If you're trying to focus close by, it'll be a bit smaller. If you're trying to focus on an object in the distance, it'll be larger. Then there's the lens. Okay, again, has a curvature to it. So light, of course, passes through the lens. It's the retina at the back of the eye. That's here's your optic nerve. All of the light information captured at the retina passes through the optic nerve, and this goes to the brain, where it is then interpreted. Okay, so that's basically how you see. Where the lens is concerned, I'm going to put it right here so you understand. Good. This right here, these are the ciliary bodies, and these are muscles. So if you have an object close by and you need to focus on that, and these muscles squeeze the lens and makes it thicker, so you can focus on an object that's close by. If the object is all the way in the distance, these muscles stretch the lens, makes it a bit thinner and longer, so you can focus in the distance. Cataracts really involves the lens. Okay, so a cataract basically is when the proteins and fibers of the lens break down and they are no longer transparent and they are rather opaque, and light doesn't travel very well through them. And that is what the cataract is. The cataract is that region of the lens that has an altered structure that takes it from being clear to being opaque. Okay, so now we're coming to the causes or the risk factors of the cataracts. So again, coming back to the lens, the cataracts form in the lens of the eye. Okay, so when the lens, the proteins and the fibers of the lens are altered and they change structure, what you have is that you move from a clear lens to an opacified lens or a darkened lens where the light doesn't travel through properly. So one of the risk factors would be age. So by age 40, what tends to happen is that the proteins and the fibers begin to break down and they begin to clump together. And what you have is a clear lens turning into a more opacified or darkened lens where the light doesn't pass through as it should. Especially uncontrolled diabetes. In diabetes that is uncontrolled, you have a deposition of sorbitol in the lens of the eye. And then what happens that this draws water into the lens of the eye, and the additional water, it will distort and disrupt the structures and the manner in which the proteins and fibers are laid out, leading to, again, the opacification or darkening of the lens of the eye. Excess UV exposure. So the excess UV, what it tends to do, it tends to damage the protein in the lens, okay, and that leads to, again, a darkening or cataract formation in the lens of the eye. So if you you're outdoors a lot, wear the proper protective glasses or the protective shades that would block the UV light. Smoking leads to a lot of what is called oxidative damage. A lot of free radicals are produced in the body when one smokes. Free radicals cause a breakdown of the structures of the lens, leading to cataracts. The excess alcohol usage. So with the processing of alcohol by the body leads to a lot of free radical formation. And again, these free radicals damage the proteins of the lens, leading to cataracts. High blood pressure. Again, this leads to a disruption of the structure of the lens, leading to cataracts. I'll come to these two here in a while. Prolonged steroid usage. So if you have some sort of medical condition where you are using steroids for a prolonged period of time, the steroids, they tend to bind to the proteins in the eye and in the lens, and then this tends to disrupt the structure of the lens, leading to cataracts. Two other factors that can lead to cataracts is if you had a previous eye injury or some sort of inflammatory process or infection of the eye, and even previous eye surgery can increase the risk of cataracts forming. Okay, so let's take note of that. So now we're going to speak about some of the symptoms of cataracts. This is by no means meant to be a fully comprehensive list, but it is a short list of some of the common symptoms you will see in cataracts. First one, clouded or dim vision. So as you can imagine, if you have the lens where light would normally pass through unimpeded, and then you have some opacity or clouding, obviously not the same level of light or amount of light is going to pass through that lens. There is going to be a reduction in the amount of light that passes through that lens, which is going to lead to some dimming of the vision. Of course, the cloudiness or the cataract here is going to do some scattering of the light as well. Okay, and this can lead to some of the cloudiness of the vision or some blurred vision too as well. Reduce night vision. Obviously, at night you need the maximum of light as possible, and at night time, of course, there's a reduced amount of light. So this is further compounded by cataract, which already in the daytime is reducing the amount of light that is passing through the lens, and now at night time you have less light. So obviously at night time your ability to see is going to be far reduced. The halos are one of the classic ways in which this is described is looking at the street lights. So in looking at street lights, let's say this is your street light here, okay, that normally would look more or less clear to the average person, but when you have cataracts, people describe halos around the street lights. Again, this has to do with the scattering of the light due to the cataract. Frequent changes in glasses and contacts. Now, when you have cataracts, the rate of development of cataracts is not going to be the same in both eyes. So, what's going to happen? So, let's say one eye, two eyes. So, let's say this eye has a cataract developing. The next eye may not be as severe, maybe a bit less. There's not going to be symmetrical development and progression of cataracts in both eyes. And of course, when the cataracts begin to progress, you may find one is going to progress faster than the other. And this is going to lead to distorted vision, blurred vision, leading to this very frequent need to change your glasses or your contacts. The fading and the yellowing of colors. Again, so the cataract itself, again, is going to lead to less light being able to pass through. So obviously, if you have less light passing through, you're going to get a fading of the colors. The cataract itself, of course, is opacified, and it may have a certain tint or coloring to it, and that is going to lead to in some people, a yellowing of the colors. Reduced ability to detect contrast. The brain is going to need a certain degree of information or light input to really detect, to distinguish one color from the next. So this reduced ability to detect contrast. So let's say, for example, the average person is going to be able to tell the difference between a black object and a blue object. So yeah, so there's a contrast between these two colors here, between black and blue. But in cataracts, a person may not be able to distinguish the difference between black and blue. Okay, so again, so that's a next symptom where cataracts are concerned. So now we're going to talk about the different types of cataracts. So I'm just going to do three general classes here. Right. So there's first of all, the nuclear cataract. So with a nuclear cataract, that is where the cataract begins to form at the center of the lens. Okay. Cortical cataract, that's when the cataract begins to form on the rim, on the edges of the cataract. And the posterior subcapsular, that's when the cataract forms on the back surface of the lens. I just want to talk a little bit about these two here, how these two relate here. For example, now let's just say you go for an eye exam and you have a nuclear cataract. Okay, so that's the lens, and there's a cataract right in the center or close to the center. So that's a nuclear cataract, and the person looks at the eye and said, okay, you have a cataract, you're seeing this here. So let's say in a situation where you have cortical cataracts, where you see a cataract just on the rim right here. Now, if the person doesn't do a dilated eye exam, okay, now with the dilated eye exam, that is when the eye drops are put into the eye to open the iris. If you remember from the anatomy lesson here, this is the iris here. Now, when you put in the eye drops to do a dilated eye exam, what happens is it opens up the pupil, allowing you to see more and more of the lens. Let's just say the lens you did an undilated eye exam, and then you had a cataract forming on the rim of the lens. Obviously, if you're looking here and this is not dilated wide enough, you're not going to see a cataract or a cortical cataract just on the edge here. So just keep that in mind. It's always best to do the dilated eye exam if you're going to be examined for cataracts, okay? Because the dilated eye exam open the pupil wide enough, allowing the doctor to see the entire lens. So investigations and diagnosis of a cataract. So at our office, we do the dilated eye exam. And again, when I say dilated eye exam, that is where the eye drops are put into the eye to dilate the pupil so we can see the entire lens. And one of the solutions we use here is the tropicamide. See that here? Tropicamide 1%. Okay, that's one of a couple solutions that could be used to dilate the eye. And then here at the office, we have our eye specialists who come in and they use the slit lamp. The doctor will be on this side using the lens to examine you. You will rest your chin here, and the doctor will instruct you to do certain maneuvers where he can examine the eye properly. And not just check for cataracts, but also other eye pathologies, even early signs of glaucoma, diabetic retinopathy as well. Okay, so the dilated eye exam has many uses. It can look for conditions, not just cataracts, but you can investigate and diagnose cataracts using the dilated eye exam, again using a dilating solution and a slit lamp. Treatment of cataracts. Currently, the treatments available would be surgery. This particular surgery, a technique called phacoemulsification is used. What this is, it is an ultrasound device that is used to actually break up the lens, and then a vacuum is used to basically draw the lens out of the lens capsule, and an artificial lens is put in place of the original lens that was once there. Okay, so now let's come to the anatomical model of the eye again. So for this procedure, you'll be awake, and what happens is that injections will be used to numb the eye and paralyze the eye muscles. And what's going to happen is the surgeon is now going to go through cornea, and they're going to use the ultrasound device to liquefy this lens here, as well as then use a device to suction out the liquefied lens. And then through that same incision, they are going to introduce an artificial lens here. So that's what cataract surgery is all about. Cataract surgery is about removing the natural lens and then replacing it with an artificial lens. What can we do to help to slow down the formation of cataracts? Now, you may not be able to entirely prevent cataracts. It's said that if you are old, if you live long enough, you eventually are going to develop cataracts. But of course, everybody would like to at least take some measures to slow down the process, or when cataracts do come, that they're not as severe, needing surgery. What we can do to help to slow down the formation of cataracts, get regular checkups, regular eye checkups, making sure that we catch problems early, quit smoking, reduce alcohol consumption, control your diabetes. This is very important. A lot of diabetics are uncontrolled in this country, and it does lead to blindness. In addition to blindness, stroke, heart attack, kidney failure, foot ulcers, loss of limbs. Okay, so this is very serious. Of course, eat a wide variety of fruits and vegetables to get an appropriate amount of antioxidants in the body. Remember, free radical formation, oxidative stress. These are contributing factors to the formation of cataracts. So using your diet to help to reduce inflammation, oxidative stress, free radicals in the body would help with the slowing down of the formation of cataracts. So following through with the slowing down of the formation of cataracts, give some typical lifestyle changes that you can make. But of course, everyone wants to know what can I take? Are there any supplements? I would definitely recommend you look into these three here. There are supplements available with the lutein and zeaxanthin, and this is an interesting one available in eye drops, the N-acetylcarnosine. I'll talk a little bit about this here. The carnosine itself, carnosine eye drops, were actually used in dogs, okay, that had cataracts. Okay, and this did seem to work for the dogs that had cataracts, and it was modified into N-acetylcarnosine for human use. This has to do with the different types of metabolism between dogs and humans. So you can do some reading on this here, N-acetylcarnosine, where it pertains to eye drops, cataracts, and overall eye health. Okay, so I hope you enjoyed this talk on cataracts. If you need to have any dilated eye exams here in Chin Chin Road in Cunupia, you can give us a call and we'll book you in. I'll have a chat with you over the phone. So thank you for your time.